That morning cup of coffee you're holding, could it be the real cause of your hemorrhoid pain? It's a question that brings a lot of secret anxiety, and one I hear constantly in my clinic. My name is Dr. Sarah Collins, and as a specialist in this field for over a decade, I've helped countless people solve this exact problem. The good news is, the answer isn't a simple yes or no. But by the end of this video, you will have a clear, confident answer for what coffee is doing to your body, and you'll have a concrete plan to find relief without necessarily giving up your favorite ritual. To understand the whole story, we first have to look at why coffee often gets the blame. There are a few key arguments, and they all have a grain of truth. The first major concern is dehydration. You've probably been told that coffee is a diuretic, meaning it makes you urinate more. The theory goes like this. If you're dehydrated, your body will pull more water from your colon to compensate. This results in harder, drier stool that is much more difficult to pass. That difficulty leads to straining on the toilet. And as we know, straining is the #1 enemy of calm, happy hemorrhoids. The second issue is irritation. Coffee contains natural oils and acidic compounds. For some people, these compounds can directly irritate the sensitive lining of the rectum and anus. Think of it like putting a drop of lemon juice on a small cut. The acidity causes a painful sting on already inflamed tissue. This irritation can make existing hemorrhoids feel more painful, itchy, and swollen. Finally, and this is a big one, there's the issue of diarrhea. The caffeine in coffee is a well-known stimulant. It stimulates your brain, but it also powerfully stimulates the muscles in your digestive system, a process called peristalsis. For some individuals, this stimulation is too much, too fast. It can trigger urgent, frequent bowel movements or outright diarrhea. Frequent, aggressive wiping and the acidic nature of loose stools are a terrible combination for an already inflamed area. When you put it all together, it's easy to see why coffee is often painted as the villain. But hold on. Before you throw out your coffee maker, let's look at the other side. Because for a different group of people, that same cup of coffee can actually be a hero in the fight against hemorrhoids. How? It all comes back to that same stimulant effect. Remember, the primary cause of hemorrhoid flare-ups is straining due to constipation. Many people struggle with bowel regularity. They don't get that urge to go, which leads to stool sitting in the colon, getting harder, drier, and more difficult to pass. This is where your morning coffee can be so incredibly helpful. That same caffeine-induced stimulation can produce a gentle, predictable urge for a bowel movement. By stimulating the colon, coffee can promote regularity. A clockwork morning bowel movement, one that is easy to pass without straining, is one of the best things you can do for hemorrhoid prevention and management. And what about that dehydration argument? Well, it's a bit of an old myth. Recent studies have shown that the amount of water in a standard cup of coffee more than makes up for any fluid lost through urination. For a regular coffee drinker, the body adapts and the diuretic effect becomes minimal. For the person who struggles with constipation, a morning coffee can soften stool and stimulate a bowel movement, preventing the very straining that causes hemorrhoids in the first place. So, is coffee good or bad for hemorrhoids? The truth is, the question is flawed. The real question is coffee good or bad for your body's unique digestive system? It all boils down to your individual response. There is no universal rule. How do you figure out which group you're in? You need to become a detective of your own body. I call this the coffee drinker's audit. Ask yourself these questions honestly. First, timing. After you drink your coffee, how long does it take before you need to use the bathroom? Is it a frantic, immediate rush, or a gentle, predictable urge that arrives within an hour or two? Second, consistency. What is the result in the toilet bowl? Are you experiencing loose, watery stools? Or are you producing a soft, well-formed stool that passes easily? For you fellow detectives, the ideal is a type 4 on the Bristol stool chart. It's shaped like a sausage or snake and is smooth and soft. It passes without any straining. Third, feeling. How do you feel afterward? Do you feel empty and relieved, a sense of complete evacuation? Or do you feel raw and irritated from a difficult or overly frequent bowel movement? And finally, frequency. Does 1 cup help you go once in the morning? Or does your coffee habit have you running to the bathroom multiple times throughout the day? If your answers point toward gentle regularity, easy to pass stools, and a feeling of relief, then your coffee is likely a friend. If your answers point toward urgency, diarrhea, irritation, or constipation, then your coffee habit is almost certainly an enemy. Based on your personal audit, here's your action plan. If coffee is your friend and it promotes regularity, first, keep it up but be smart. 1 to 2 cups in the morning is a great tool. 5 cups might push you into the irritation zone. Second, hydrate anyway. For every cup of coffee, add an extra glass of water to your daily goal. This is non-negotiable insurance for soft stool. Finally, watch the add-ins. A mountain of sugar or inflammatory dairy creamers can cause their own digestive issues. Now, if coffee is your enemy and it causes diarrhea or irritation, you have several options. First, try reducing your intake. Try cutting it in half or switching to half calf to see if a smaller dose helps. Second, try switching to decaf. Often, it's the high dose of caffeine causing overstimulation. Third, consider the roast. Lighter roasts are often more acidic. Many people find that a dark roast, like a French or Italian roast, is much gentler on their system. Fourth, slow down. Chugging hot coffee on an empty stomach can be a shock to the system. Try sipping it slowly over 30 to 45 minutes. And finally, explore alternatives. If all coffee seems to be an issue, it may be the acids themselves. Try switching to black or green tea, which have less caffeine. Better yet, try caffeine-free herbal teas. Peppermint is excellent for soothing digestion, and ginger is a fantastic natural anti-inflammatory. That morning ritual, the warmth, the aroma, it's a moment of personal comfort, and you shouldn't have to sacrifice it out of fear or confusion. The most powerful tool you have in managing your health is the ability to listen to your own body. It's sending you signals all the time. Our job is to learn how to interpret them. Coffee is not inherently good or bad. It's a tool. Your task is to figure out if, for you, it's a tool that helps build a foundation of comfortable regularity or one that breaks it down. Use the audit we talked about. Be honest with yourself. And make the small adjustments that will allow you to live comfortably without sacrificing the simple pleasures that make your day a little brighter. You deserve that peace of mind.